There are mounting concerns over the coronavirus Delta variant as the U.S. heads into another holiday weekend. The more contagious strain is being blamed for a recent spike in cases. Health officials say they're most concerned about areas with low vaccination rates. Janet Shamlian has this report.
The signs are everywhere. America is getting ready for an unprecedented 4th of July weekend.
Just a very different mood and atmosphere. No masks, a lot more people feeling comfortable coming together.
But fears of a COVID spike loom. The highly transmissible Delta variant is in all 50 states, now responsible for more than 26% of U.S. cases. That's double the previous 2 weeks.
If you are vaccinated, you have a high degree of protection. If you are not, you should wear a mask and you should think very seriously about getting vaccinated.
And there's more reason to. A small study found the one-dose J&J vaccine provided immunity to the Delta variant, like Pfizer and Moderna. Only 20 states and Washington, D.C. will meet President Biden's 70% vaccination goal by July 4th. But more people are getting the shot. The 7-day average of reported doses is up more than 40% over last week. The biggest unvaccinated pockets are in the South, with Mississippi last. In Texas, 31 vaccinated people have died from the virus this year, out of almost 20,000 COVID deaths. With large gatherings throughout Houston and across the country, Harris County Judge Lena Hidalgo is concerned.
Beneath the surface of all of that is a threat, the Delta variant of COVID, which has been growing and growing throughout the country. It's more contagious.
Houston is hosting a second year of scaled-back celebrations. Usually, this park is full of tens of thousands of people for a weekend of live music and fireworks. The park will be open, but this year it is the fireworks only. They'll be shot higher so they can be seen from a distance. Lana?
Janet, thank you. For more, let's bring in Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, always good to have you on the show. So the head of the World Health Organization says that the world is in a, quote, very dangerous period of the pandemic. Tell us more, and how much is the Delta variant to blame?
The Delta variant is the major concern that we have worldwide, because when you look at the world the way the WHO does, we're looking at an unvaccinated world. Not every place has as high a percentage of the population vaccinated as the U.S. or the U.K. or Israel or Canada. And we're going to be in for some really dire days in those countries where just a single-digit percentages of populations are fully vaccinated in the face of a more contagious variant. So this is by no means over when you look at the world context. I think the U.S. is in a good position. There are other countries that are in a good position. But globally, COVID-19 is still a major public health emergency.
So the Johnson & Johnson coronavirus vaccine is reported as being effective against the Delta variant, which means that all 3 vaccines approved for emergency use in the U.S. protect against known strains of the virus. So, Dr. Adalja, what are the risks to fully vaccinated individuals? Can we feel like, the Delta variant isn't so much a concern to us personally?
That's how I would approach it, that if you're a fully vaccinated individual with any of the vaccines that are approved in the U.S. or even the AstraZeneca vaccine in the U.K., the Delta variant is not going to pose a major threat to you. Where we see the Delta variant being a major issue is in those pockets of unvaccinated individuals where you're going to inevitably see spread in cases. Hopefully enough high-risk people in those geographic areas are fully vaccinated so you don't see a major crush inside hospitals. But we're already hearing about places like Springfield, Missouri, where hospitals are stressed out, not quite to the peak levels of the early days of this pandemic, but it's something that's completely avoidable just by getting more vaccine into people's arms.
And this weekend is, of course, the 4th of July. Happy Independence Day weekend to you, Doctor. As you know, President Biden was hoping to celebrate, quote, independence from the virus, but less than 50% of the population is fully vaccinated. I'm wondering if you still think that it is possible to get 70% of Americans vaccinated at any point, and what are the risks if we don't reach that national benchmark?
I do think that we'll eventually get 70% of American adults with 1 dose of vaccine. We're closing in on that. It's like 66, 67%. And we're seeing people inch forward with getting vaccines, especially as people are taking notice of the Delta variant and getting vaccinated as vaccines are more convenient and easy to get, and as we approach full FDA licensure for these vaccines. So I think we'll get there. But the goal of the vaccine program really was not to drive cases to zero, but to remove the ability of the virus to cause serious disease, hospitalizations, and deaths, to kind of defang it or tame it. And I think in the United States, for the most part, we've done that. So we're in a good position because so many high-risk individuals, those above the age of 65, nursing home residents, are all fully vaccinated. And those are the people that were at the highest risk for hospitalization. So right now, we've moved away from worrying about a systemic crisis in hospitals like we had during the pre-vaccine era to one now where we're trying to tell people that it's their individual health that's going to be benefited if they get this vaccine. And we want to drive COVID numbers as low as possible so it's as least disruptive as possible as it can be. But I think we've done well when it comes to what the goal of the public health emergency response was, of flattening the curve and preserving hospital capacity.
And I imagine there's some comfort that you take in seeing that vaccination rates are at least increasing week over week from last week. One last question for you, Dr. Adalja. President Biden says that he's concerned that lives will be lost if unvaccinated people catch and spread the virus this weekend. What's your advice for all of us, vaccinated or unvaccinated, so that we can still gather and enjoy the holiday?
So if you're a fully vaccinated individual, I would celebrate the 4th of July just as if it was 2019's 4th of July. But if you're unvaccinated, I would be very careful about being in crowded and congregated places, especially if there are a lot more unvaccinated individuals around you, because this virus is going to be there with you. So you've got to be careful, especially in indoor settings where transmission is going to be heightened. I would advise some of those individuals to wear masks when they're in indoor settings. And when they're outdoors, try to avoid the crowded and congregated places. We know outdoor transmission is less, but if you're in big crowds outdoors, you may still have transmission. You just have to be very vigilant if you're not vaccinated, because this is still a risk to your individual health, and this is something that you don't want to contract or to spread amongst other unvaccinated individuals.
All right. Dr. Amesh Adalja, thank you for joining me, and thank you for all that you do.
Thank you.